Okay, so we'll move on to the technical session. Can we have, we'll straight away go to theater 6. I think now Dr. Chandra Mohan have started already his case. Can we go to theater 6, please? Can we hear from Dr. Madhushankar? So we are going to start.
Hello, sir.
Yeah.
We are in the theater. So at theater 6, we are starting with the patient 1.
Yeah. Can we have slides of that patient and can you describe the case, please?
So I will brief about patient 1. Patient is 41-year-old male patient.
All right. Okay.
Who is incidentally found to have lower renal stachyon calculus and underwent multi-track prone mini PCL and without any complications discharged and again developed post-op hematuria on day 10 and angioembolized and complication managed, and now he is having some residual calculi at lower moiety. So he is awaiting completion surgery, and now we are operating on that patient. So we'll move on to the theater.
Can we have the next slide with the current images?
Yeah, so this is the current status of the patient. So at the left side, you can see it's a bifid system with low moiety, some residual calculi, and stent also in situ. So it would be a challenging case because of the lower moiety and the residual calculi. Right, thank you.
Can I ask the moderating panel to start the discussion?
So I admire you to do this in public. So there's the double J stent looks a little bit encrusted to me. You're thinking that has some stones already on that?
Okay. Madhushankar, can we have the previous slide? Can we play from theater? Can we have the previous slide from the theater? Right, thanks.
Do I also see a bladder stone, or what is that?
Oh, that's contrast side.
Sit still up to the slide. You let them wait. Then you put in the phone at that. And I said,
Yeah.
Dr. Fadi, I really admire you to do this case in public. Can you tell us your approach?
Yeah.
Do you hear me?
No.
No.
Dr. Chandra Mohan, can you hear us? No. We can see you. Yeah, now we can hear.
Hello, sir.
Yeah, we can hear you.
Why? Like the outlet, I had CSM Urological also conversation. Why waiting it was what's not on touch with the adversary. Whether we get with Dr. Michael Gross and other senior planners across the world for moderating. We have the students we got last 10 years from them on the conference at the various workshops. They studies one as God volume stock. We just see that. And when we saw the there was on in the ankle on the same bookstores on there. That it looks like actually what it is not sure. Then it does not store water. We had this way. This idea is what I have thought goes idea. Go inside, click all together says, right, there's the activity stories not don't I think what's up. Why people what they do here. Don't try to be too hard what is one sword again what's up at the gate. Rather than mind is my direction. Who wants to be honest? With what the other is, we are. And it is one of the very good scope of the court study. And we have in this one, yes, our court slot. And we have access 2 nights. One is clear petra, second back to make one, back to natural gene. Other parts one is more correct, that is flexion, accession. Clear petra is giving also the but that will be not used initially. We use that control to control. The eight is this is a binary system. So initial level, with that return, to take out the state, the returns, next unit going, look to the system, right, path the them, work, stop, other, stop what you want to get. At that is like, what are they me? I have a patient in the IRS position where I can have access from the city called Diet Iraq Contact Area or I know later can expand for me. I want always wait the pick up quickly. Direction compassing I proceed. Here the I is here the I that position have little leg of the downside of time way. The time I exposed at the power area my two my right side I am my left side my easier because the old left side is the opposite side. Here comes from the opposite side naturally like most easier that come from the right side. As here I could be here because what I have here I could get up the left side on the right side on the right side no problem. But what we have the opposite side. That's why the kids on the left side and me on the right side. Here on top that's here that piece on top. Here on is on top and then third on area on my right side because I could take that. I did. I don't want the steps. So I get pretty big all the afterwards later. So then I got my cut that check. These become like so that nobody can come with late like for going me. You know, just making the arctic plus laptop slider that the like I see that decent or that iron or that I could read that all the combat that last takes me but that's it because you don't see common. I think I should recall the first step I feel to the scope of the UETA. And you know, so now I'm going to what my ability on I have two sleeves here. One is Flex XC, another is ureteroscopic view. When you go with ureteroscope, you should have already removed the stat. As if you put it of the ureter, the never step is there, there will be the count of the certain little amount of the class there. You should not worry. And water is flood. Now I am going in the ureter. I am going in the ureter. These parts will be there after detecting this is the exact package. What store is there here? We are harnessing the bifurcation. Either pneumatic detector or laser can be used for those who feel that laser has to be used cautiously. I am not put any guide. Only thing I need is written perception of the ureter. Carefully, and now I go nearer to this stone, that's the first step. And I'm using the center, low energy. Ready, that we are using 1.10 can reduce it to 0.8 mNOT. I have my colleague Dr. Gebhardt, who is part of my team in Hyderabad, to this week is urologist. 0.8 and 10 that is still high, but it's okay when we see At this appearance of the stone also, we can understand whether it is suitable for RIRS or not. Ready?
So may I ask one question? Why are you not using a safety wire?
Yes, a safety wire is useful. I can use the no problem. Is it more suggestion? Can you use the safety wire? You see, using the center incompetently. Don't use continuously because vision will get affected. Try to make these seasons before it two. Make it four. And that will move by forceps which you are used to. And don't try to do powder like in RRS. The moment you start doing powder, the energy will be transmitted partly. So they see like this, quick is the card bench breaking. You are now, I have a gut feeling that I can take out all of them with the forceps. Then if you the forceps, this is the Cascai corridors bench breaking so that maximum volume can be removed. Even if we see them without making dust, which are harming. So now, after this, IRP guideline is very important here because if you do the track, the entire thing can be spoiled. These particle stones, whenever you do PCLC, that's all I wanted to do. Now I have sapphire. Now I can use the forceps. I order each of them. Rotate, come on the floor. And if you want, you can use water for short period, but don't damage the curator. Now dropping the bladder, don't try to come out again and again from the restaurant. Water please. There is checking the water. You should have patience. And you should start immediately start the entry into the curator, which is not good. If you want to take out the forceps, these are very important for curious if at all anybody there the audience. They are very important. If the advice there, it makes the job very easy. That's a very important suggestion given by Professor. Now, every time when you enter, the guidewire is very, very useful. But taking my little experience, I'm taking charts. Yeah, it is like this. This is a not very hard stone. So good for me for eyes. And water please. Yeah. Slowly on the floor, rotate, and take it out. Again, remove the forceps, and again go with the nectar. After this, I will try to identify the piping system. After removing these pieces, they are pushing them inside. And the push inside again, they will become harder. For the RRS, no need. Taking the equipment slope is better. But in the dangerous position in the ureter, they are quite up. See, I'm holding up equal a little bit. That should be there. And if you have the problem, you want it to laser again, it's better to push inside the managed by RRS because RRS is much safer. See, this because of the long stand. The separate gap joint Peter. Actually bending and sitting down. Don't do that. These backwards are very important because ureter very important here. Whenever you use strike prop, you should be careful. Rotate, come on the floor and take it out. These fragments they will take out and be dead. With the next select with that or anything of the microphone. See what happens. Be careful. Every time you tell how I can, I should pop the gentleman. So that is the important suggestion. We must accept hard race. This is the last piece. But let us as we carefully here. But with this, I will not be able to pass the answer sheets also. I pass the guideline. I'll take the suggestion. and I can keep the guy outside. So, go Baba. Even studied about the space. That's been upgrading the turtle and the right. See, I passed the guy like, but as much as possible, take this movies of time. Absolutely no problem. Take out the guide body.
One question: Do you pass this guide wire under fluoroscopy, or do you do it blindly?
We can check under fluoroscopy, but the way it is gone, by experience, sometimes if you cooperate also, again, it's a very important point. The current points to my experience, see check what, it's speed of urology. That the one is I can part those, check it, check, yes. So now, what access sheet and not, we start playing the access sheet. See up this level, I'm having problem, and this is the vacation area. It looks like for me. I will take chance of take out the I will proceed further with the access sheet. You may go something with the extreme but this turboscope is very like switch. Extreme practical turboscope system sometimes in the program, especially the transfer like I'm almost sitting on the throne. I'm over it. Not a big slot, just not back on and then on I sort of.
May I ask one question for your own positioning? I mean, you must do that for a few decades, and by that time your spine is almost broken because you bent your neck. And so, what is your standard position? Are you usually standing, or are you usually sitting for this procedure?
Because for like all long time of between cycling up to the RGB done. I think stop. Then can go for start. And stop. Then I have the then I will should be check color is 0.5 of really careful. Very, very good. Yeah, like here now. At least I want to spread the fight. I has started to be upper condition. I will find these notes. No, it is back for me. Okay, well. Well, but say, see, I think the contrast from see, if the contrast space, that the shot, or ugly.
So how are the rules in Sri Lanka? Who is serving the C-arm? Is the surgeon doing that, or do you have a radiographer?
Yeah, pretty part of it. Radiographer. Like a cross time, there's a big store-like structure which is not the store. Somebody showing you. But I said yes. No, I might stay at the Christ in the same. Yes, come on. These are all things. Actually speaking, this board water is very nice. We thought something else. We're quiet. Yeah, but probably not necessary. With one stone, two stones, some small stones, and one bigger long structure, which is unlikely a stone. And why it's still quiet. So now I should trust the contrast is here, but then the record, I found that the focus. Yep. Come down, bacon, you should come out. Better like this thing was turned up. They're nothing. For that piece, come down. They're like, you're sure. Is it got us? That's that. Yes, they got the there's another back system we do select. That thing so hard.
This is real life. Thank you so much.
It's the thing that's in your dog is not seen here. So there are three water animals of what not so long it did. So they think what to see the discuss can keep good also. Tip sorry, what boss? Yes. Okay. That probably after the other reason that I pick up back. That is another part that's why if I press the start, obvious engine, go up for like that. See how big you down. And you come on the rent. Yes. Okay. Stop direction. Not causing not the guy to tell you not just this. It's true. It's all drop that you prepare and that. Don't worry, story. Worry not head. Part of this.
So where do you inject the contrast? Into the instrument?
What's up?
Where do you inject the contrast? Into the instrument?
That nicely. Not only is one, so everything that this component of the planet's going to not be able to handle very hard ways back. I'm connecting. I got back to got on it. At that, I didn't fight snake box or out of the odd places. So be careful. The network that must the spot people that have going to contrast the those ways that is it better. No points that get blocked out, blocked up, makes it devices. No problem, it makes it work. Is it like I had this day, the Lord wants this one? I need not spend much time, yes. Live for dust. All about the stuff. Yes, did not be there. That yeah, go up, go up. Stop, go up. Below, anything below. The nigger like angle is definitely inside the guard system. Here the contrast is coming out. I want this that one inside the axis sheet facts. That being the I use the axis reflex at C. This is what's internal important. The concept we suggested for the guideline is the fact of the lungs. Always take those suggestions how I read it. I get for the see after stuff tracks. Paper plus if they do that because 46 centimeters. That's pretty flat. Very flat. Because I hear that Church Expo, I looked up here. I've got LA of causing but must be careful that it may what if that system caption system of the lawyer on 2 years of practice after this year we should go. Why not they see it water please? Yeah. Okay, yeah. Water please. Don't generate to me for the access sheets, water please. Yeah, you grab. Don't generate the thing. Water please. Should become. Water cylinder. All this stuff.
So I would like you to get involved as well. So if you have any questions or smart comments, we need to grill them.
Well, because we have no. Has there.
I should put that. So second wire. So just keep the first wire as a safety wire and put the second wire and pass the ureteric catheter and put the RGP and find out where's the junction. Then just get the ureteric catheter just below the junction and pass the second wire through the lower calyx and we can pass the access sheet.
Can you show this up?
I want to say that it's hotter. I mean, you are difficult enough to convince you to get understated. You fit this is the outcome like too. Especially if you do that in cutway.
Yeah, don't push the wiper system. I'm taking out, I'm taking out and keeping that. This is the, get it short here. Get it short here. Yep, this is the sheet. 10 centimeters of sheets in the outside. Or senior people will not use the patch. There's only one people that show right here. This is the section which is attached. The simple section by the hospital, which is a get it short here. Actually, simple.
We see it nicely. We saw it now. Now we see it nicely.
Let's see, get you now. I put let's see. And this is the other weapon of structure where you get correct order. Where I correct that like this. So right. Like that. The other section we put here. Simple, nothing. I think the question card is such. Yeah. Flexibility, I detail point side with the base of fiber start using. But Kramer will be using the water will go through this and we go to that right?
It's up there.
So may I just give a short comment on the instruments? He mentioned STORT several times, and all endoscopic instruments are good, no matter whether you use Olympus, STORTs, or Wolf. And you know why? They're all produced in Germany.
So I can't imagine.
Even Olympus is producing in Germany. They even produce in Hamburg, where I live. I could cycle to their factory, and what you need is service. And you're saying if the Stolz service is good here, you should go for Stolz. If Olympus service is good here, you should go for Olympus. Instruments are all good, but if your instrument breaks, you need to be able to call your rep in a second, and he has to be in your office in 30 minutes time.
Yeah, I agree.
Maybe at this traffic you're giving 45 minutes.
It's happening more at all. So I'm now going into the actually you should be careful here. The main assistant wording transition into the dot because actually get progress. Now you flush water, I get so popping part pops, we avoid it. You have the system.
For the younger colleagues of ours, and these suction access sheets, they are new.
So there,
And I'm not quite decided yet whether I think it makes additional sense or not. Are you using it? Have you used it yet?
all that.
No. All I know, being responsible for the budget of my department, it adds another €100 to my procedure, which is
Yeah.
30,000 rupees.
Yeah.
So
So almost time in the kitchen now I be going to see that the sheets. These are the participative or kind writing. Now I going to create stuff. See, predominantly it's empty, that's what I thought.
could you just give one command where you exactly position the access sheets?
Access sheet, I'll come back up short. That to be no. If you go more inside now, find something like suppose see it is section. It is sucking. Please do section. What's like be do the section? Yes. Do the pushing. See it's what I see. So all it does, all the whatever it grab, it everything's up here.
So this is not a continuous sucking, it is intermittent.
You see the pattern like nothing the section is going on. All the dust is very clear. Can it here? I take all by letting it to this also by story by experience pattern. Oh sorry.
Can you stop here? Can we have a look? Because this is very educational for the younger. Can you show the papilla, please?
Thing back.
Here or there? You see this this.
No, please. I have got like the I thought one. So the both sides to her or I ask you to be because I have sheet or my woman's.
You saw these fittings and this Randall's blocks. Randall saw that in 1942. And he didn't know what it is for, but because at 1942 you were not able to look into the ureter. The first uroscopy was done in 1982 by Huffman in New York. And
Let's keep going. I want to start basic this. I think we be stuck down. I did not do 100% program. This is that thing like it's for I have not just in it. Hi. Not even my base of my body.
I hold my breath if I see how you advance the laser fiber through this bended instrument. Are you not afraid that you are scratching through the surface of your instrument and you destroy it? I've done that in public in a workshop.
The best position. I have got the first get up by too much. It means it will got for that I can't feel. Whether I can reach the same system. Which I have shown out ETR is the push button. So I repeat one of these. One of the just need to the class. So be with me. Just to start get the sucking. To this about this back.
And you still are at 0.8 and 10 hertz and 0.8 joule?
Oh, I wanted to bring you to what's that? The train, what the? If you're reading the deep can kill the booster as a part of the TV, but be able to check the fragments come up. The show cover don't touch the photograph. Almost on even. Ready? I think we can a quick minute. Ready? So like this thing can be up on here and then fragment inside. That's no problem. So I have very over, especially, then try to order so I can
Get what?
sign you.
Maybe.
So I for people, that is, that floods or I pretend what inside. Yeah, when I go inside and cut, it doesn't make what 6 o'clock.
I find it very interesting that he's bending the garment so tight. I always try to keep it straight. I'm using reusable instruments, and they cost about 11,000 really, times 300. So a lot of money. So I want to have it as long as possible. And in average, we have it about 50 cases, and then
Then shut.
we could
Get back to it, but this is not about what you try to extract out. Don't push up, yeah, bucket, but from the cell. After struggling, I mean,